Well, before I ever got the flu vaccine, I never had the flu. After I started getting the flu vaccination, when I first started nursing schools, we had to have it. I never got the flu. This past year, I got the flu vaccination, and I got the flu. It's going to happen. That does not mean I'm not getting a flu vaccine this year because it sucked. It was horrible. And then it turned into pneumonia, which is even worse. And I've got a whole new respect for people with pneumonia. It's not, I didn't respect it enough. Anyways, so flu, antifungals. The whole thing about amphotericin B, that's really something you're not going to prescribe it. You will see it in the hospital sparingly. Remember, it used to be called amphotericin B. It will kill your kidneys in a heartbeat, and I rarely ever use it unless I'm in a serious situation like cryptococcal meningitis, somewhere where this patient's in the ICU. They're going to die if I don't use it, so we'll save the kidneys later. Right now, that's not going to be on your examination, amphotericin B. Now, lots of antifungals that you are going to be treating, or your, of course, candidiasis, oral intriginous, Candida albicans can appear in many places. And always be aware of this, especially in female patients who you're prescribing antibiotics to. A lot of yeast infections can crop up, okay? So nystatin, very good. For topicals, powders and creams work. Oral, definitely swish and swallow. Now, I have also seen on occasion people who have stomach pain and reflux to have candidial or candid. I can normally say that word, and I don't know why today I can't. Anyways, it'll be a gastritis of candidiasis, and oral swish and swallow will work because it's going down the hatch and it's going to coat that. So other infections, of course, your toenail fungus, and we've all seen the little guy on TV who's jumping around with his pitchfork in your toes. Remember, systemic antifungals. Toenail fungus infections are very difficult to treat. Topical infections, topical treatments almost never work. To treat some of the surrounding skin, if the irritation is there, a lot of the topical ointments or sprays will work, but typically a systemic medication, azole, ketoconazole, fluticasone, or fluconazole. In fact, here's an azole thing over on page 351. Look at that. Those things are going to be what's necessary. Bottom line, most like really bad toenail fungus, nothing can treat it except for toenail extraction. Okay. The only way you'll see that on the quiz is patient has toenail fungus. This person is still young, likes to go outside, has just been unfortunately cursed with this stuff. You've tried everything under the sun, and this patient has come to you and says, yes, I want this treatment. What might you consider? And that would be toenail extraction. I'll be surprised if that's on the quiz, but if I run out of things to ask you, keep that in mind. Okay. Anti-protozoals over on 353. So, we live in a world where people travel a lot. Mission trips, business, whatever. And believe it or not, I do see a fair amount of traveler's diarrhea. Typically, it comes from some sort of an organism that somebody picked up wherever. And we want to treat it. Now, unfortunately, most diarrhea infections respond to the same thing. Here we're talking about metronidazole, flagyl, or the other nidazoles. These are very effective in treating, of course, you've seen it in the treatment of Clostridium difficile, which is a bacterial infection. However, these are very useful for the treatment of protozoans, amoebas, things like that, stuff you're going to drink in the water or whilst swimming or in some contaminated food. Anybody with diarrhea, especially if they've traveled abroad, always consider using something like Flagyl, metronidazole. Okay, you can read there about the other azoles. Flagyl is the one that is most predominantly used. You will use it. It will very well cover what that medication does. Okay, anti-helminthics, worms, things like that you're going to get. I actually have never treated a worm infection. Uh, there's not even anything in that section that's going to be on the quiz. Uh, just know that the medications that you treat those also end with azoles. You may find them in the clinical setting if you do a stool sample and you're able to detect a worm. Parasites, malaria. Again, these are things before you're treating for them. You need to be real sure that's what you're treating. Ask have they traveled? Are the symptoms very consistent? Can you not prove anything else? Okay. Malaria is actually still pretty common in a lot of places in the world besides America. We all know about sickle cell disease and how that's evolved to actually help kill malaria, even though it's harmful to the patient. The oldest of treatments for malaria, quinine, is still used. It's also used to treat rheumatoid arthritis. Yeah, I don't think. Study up on the malaria section. That's really probably going to be it. My main concern is for you to know by far mostly about the antibiotics. I mean, like I said, you've got to know all of this stuff, but it's an awful lot to cram into one thing. So for the purpose of the quiz and things that I know you're going to need immediately for clinical use, even in clinicals, definitely antibiotics. Definitely antibiotics. As far as antifungal goes, definitely think about candida, yeast infections, or other yeast infections requiring an azole. Flu vaccine. Everything that I just kind of talked about throughout this entire lecture, hit on that, but antibiotics, just nail it down, okay? I think I will leave the quiz open for a week, just like I did last time, since it's a more substantial section. Oh, here's some sideline information. People are asking about the bonus question that I listed that was in one of the quizzes. Number one, it's a good reason to watch the quizzes because that may be the only place you see about the bonus information. I've gotten responses from almost everybody. You're all absolutely correct. It has to do with bradykinins, substance P, all the things that we learned about in physiology cause that cough. Now, what does that mean? Why did I ask you that question? What's it going to matter to your patient? Well, it may not matter anything to them, except for that it's causing them a cough and they need to be on some kind of medication. But very valuable for you to know these kinds of things, okay? So everybody's got 2% extra bonus for that. Remember, you're not going to see bonus added on until the very end. Also, right now, you're not seeing your discussion board grades on the grade book. I've got to actually schedule some time to go meet with the computer people on campus. There are some parts of Blackboard that I just can't figure out. So I want to get the grade book right. Just know everyone, number one, is passing, and I expect everyone will continue to pass. If I'm constantly checking your grades. If I think that something's going wrong and there's a trend that shows you're not doing, I might say, hey, is there anything I can do for you? Otherwise, I have full confidence everyone's going to make it through this course. Oh, one other thing the quizzes. Sometimes you're going to take them, and then all of a sudden, a lot of people saying, "Oh, I see that there are 2 opportunities to take this quiz. Can I take it again?" Here's why I'm doing that. I only intend for it to be taken once, and please only take it once. Some people are getting kicked out, which I understand. It happened to me a lot too. Internet connection drops or whatever. If you do get kicked out of the exam, of course you can retake it. That's not your fault. So that when people start texting or emailing me say, "Hey, I just got kicked out," the only way for me to reopen it is to give multiple attempts. So here's the deal: if you took it once, that's it. If you took it and you got kicked off, take it again. I'll know the difference. Blackboard does tell me, so don't get sneaky. So if you see that a test has multiple attempts, know that that's the reason, and I only want you to take it once, okay? All right, I can't think of anything else to bore you with. I've taken up enough of your time. This looks like nearly, a little over 45 minutes. Very sorry about that, but I hope the information is useful to you. I will have the quiz concocted, and we'll open it up probably Saturday, and I'll leave it open until the following Saturday. Okay? Again, if you have any questions, comments, complaints, call, text, email. I hope that you all still approve of the way the class is going. Let me know, again, if there's anything I can change or that I can change or do better. I'm learning about this as much as you are. I hope you find everything helpful. Good luck on the upcoming quiz and discussion board, and I'll see y'all next week.